I'm pretty sure when you guys are forgetting to do things, having some memory issues in general, I know you. What are you thinking? I know you are thinking about dementia. You might be asking yourself if you have Alzheimer or some other type of memory issues. And sometimes you might be confused about the difference between Alzheimer and dementia. Today, I'm going to talk about that. My name is Dr. Zayas. I'm a neurologist. Let me start saying that everybody forget things. We cannot be perfect. Forgetting things is extremely common. For example, this is my classic example. Sometimes I will go to a place, let's say a bathroom, looking for an object or something. When I get there, I start thinking why I'm here. I'm not sure what I was looking for. So I need to go back to the initial place, the kitchen, and then I remember, oh, it was this object. A very common example is the cell phone. I'm pretty sure that you guys forget where to put the cell phone. This is a very common. It happened to me every single day. I have to use Siri looking for my cell phone. I ask Siri to look for my cell phone, and then I am able to find my cell phone, and usually the cell phone is close to me. So that kind of things. This is normal. By the way, there is a syndrome that we call tip of the tongue syndrome. Tip of the tongue syndrome is a very well documented syndrome. Is when you want to say the name of this object, of this person, and the word is not coming out. You can visualize the person, you can visualize the object, but you cannot say it. But then after hours or even a few minutes, you are able to remember. That's normal. And this is gonna get worse with time. And it might get worse also when you don't sleep well, when you have depression, when you have anxiety, when you are having a lot of stress and issues going on in your life, it might get worse. Now, let me start defining three terms, okay? Because this is a lot of, I see a lot of confusion about these terms. Dementia, mild cognitive impairment, and what is a normal aging. So the normal cognitive deterioration that you have when you get older, okay? Let me start with what is dementia. So dementia is a big term. It's a very big term, which means cognitive impairment associated with functional decline, which means that you are not able to perform the same activities that you used to do before because of your cognitive issues. When I say cognitive issues, cognitive means intelligence. And there are many domains. I'm talking about at least 5-6 domains. The most common that everybody understand, everybody remember, is memory, but memory is the most simple one, okay? The other ones are more complex. So usually when you have problem with your memory, which is one of the areas of the cognition, when I say area, domains, so you're not able to remember or having issues remembering prior conversations or what did you say before or details, that kind of things. It's just remembering things, okay? That's a simple one. Now, the other one is attention, concentration. So people who are able to concentrate, to pay attention during exam, they might get a better score because they are able to concentrate well. Another one is, for example, orientation in the space. We call that visuospatial function. So, for example, this is the ability that you have to visualize yourself in this space. One clear example, the taxi drivers in Manhattan. So years ago, people don't use a GPS to get from point A to point B. They have a map. And many of these people, the map was in the head. So I am pretty sure these people, they have a very, very good visual spatial function area. So also another example is the surgeons. Surgeons, they have a good visual spatial function. Why? Because they need to visualize all this complex anatomy in the body, in the brain, so they can perform a good surgery. So they have this area very well developed. So very important. Another one is the language. So language is another area of the cognition. For example, there are many people, they can talk, they can speak different languages. There are people, they are able to speak 5 languages. So in order to do that, you need to have a different degree of intelligence. So because not everybody can learn 3 languages. This is sometimes it's impossible for them. Okay, this is what it is. Another one is the executive function. The executive function. So the executive function, let me give you an example, is how you execute something. How, first of all, you need to have a plan, right? So those people that they can have a good plan and then execute the plan, they have a good executive function. They can follow instructions. They can follow complex tasks step by step. They know how to go from point A to point B and then to point C. They know how to assemble things. And sometimes this area of the cognition is combined with the visual spatial function. It's like a network that they work together. Okay, so this is another one. Another one is the social function, the cognitive function. So this is one of the one that people forget, but this is how you are able to interact with other people, how you are able to interpret emotions of other people. Another example is how you can read the body language of somebody. So actually you can be trained for that. And there are many books that can teach you how to read body language. So this is another area of cognition. So we have many. It's not just memory, there are many. And you will see all of them here in the screen. You will see all of them there. So I want you to understand that this is not just memory. There are many domains, many area of cognition. Okay, now let's talk about the middle. So we talk about dementia, and later we are going to talk about normal cognitive decline that happens when you get older. Now let's talk about the middle right here, which is mild cognitive impairment. So mild cognitive impairment is when you have deficit in all those domains, area of cognition that I mentioned before, but you are able to function. You are completely independent. You do not depend on other people for your mental activities. So you might have some deficit in one of those areas, similar to dementia, but a little bit more severe, but severe enough to affect your function, your daily activities. This is the definition of a mild cognitive impairment. Many of those patients progress to dementia, many of them, but some of them no. Other important point that I want to make is dementia and Alzheimer is not the same. Alzheimer is one of the dementia causes. There are many reasons for you to have dementia. Alzheimer is the most common cause of dementia, the most common cause of neurodegenerative process. So it's not the same. Now, there are other causes of dementia. Like I said before, Alzheimer is number one, but also when you have vascular issues, for example, you have a stroke, that might cause dementia, and it's a very common phenomenon as well. And many times it's mixed with Alzheimer and other type of problems. So currently, we usually don't say that the patient have a pure type of dementia is a combination of factors. Many patients have vascular dementia and at the same time Alzheimer's. You see this a lot. The other common type of dementia when you get older is what we call Lewy body disease or Lewy body dementia. So this is a very common phenomenon, also very common. There are other type of dementia such as frontotemporal dementia, and there are other non-neurodegenerative disease condition that also can affect your cognition significantly. For example, having depression, anxiety, having sleep apnea, not able to sleep well, many metabolic process such as hypothyroidism, having low levels of thyroid hormones. Also, that kind of things also affect your memory. So it's not just neurodegenerative diseases. Now let's explain, and I like actually to use this table to explain what is a normal aging. I like to compare this with dementia. So let's review again what is dementia, and let's discuss what is a normal aging. So everybody, when you get older, you will have a normal aging process. This is nature. This is what is going to happen. It's not just mentally, also physically. The same time that I used to do in 50 meters dash is not the same time that I do now. The same thing happened with your brain. I used to memorize papers in 1 or 2 hours. And now I cannot do that. So that's normal, okay? So you might feel when you get older kind of slow mentally in terms of the speed, in terms of the speed, the time that you are taking to read a book different from when you were 30 years old or 25 years old is different, okay? Now, let's talk about more specific stuff. So for example, one of the things that I see in the clinic and help me from the beginning is I ask myself, who is complaining here? Is the family or the patient? If the family is complaining and the patient is not complaining about memory, only report that. If you ask them and they are not concerned, the patient is not concerned, just the family, this is a key for most likely this patient have a neurodegenerative disease related with cognitive issues. Okay, that's a key. Is the patient is the one who is complaining about memory loss, the family is not too concerned. It's just the patient who is very concerned about that. Most likely this is not related with a neurodegenerative disease. It's something else, probably lack of attention and concentration due to depression, anxiety, lack of sleep. But there are many other reasons for that. Okay, so that's one of the important keys, important factor to pay attention. Number two, the other thing is a patient with normal aging, the normal cognitive decline that you have when you get older, they are able to recall incidents of forgetfulness, different from people with dementia. They are not able to do that. That's a big difference. The other thing is normal to have word finding difficulty. So even in your first language, that's normal. It gets worse when you get older, and there is a syndrome very well documented that I mentioned before, the tip of the tongue syndrome. In dementia, this problem is very frequent. It's constantly, and not only word finding difficulty, also problems understanding the sentence. So the language problem is more severe and is usually easily to tell well, with a good interview. The other thing is the social skill. The social skill in people with normal aging is the same, okay? That doesn't change. You will have the same interaction with people, assuming that you don't have depression, anxiety, which is different, right? But in normal aging, you will have the normal interaction, the normal social skill. In dementia, this is gonna get affected. That's another key. The other one is getting lost. So, like I say, how many times I go to the bathroom looking for something, and when I get there, I forgot what I was looking for. And so I need to go back to the kitchen and I was looking for this book. So then I remember. Okay. Now in dementia is different, because in dementia you get lost in your own neighborhood. You don't know how to get home in a house that you have been living there for 20 years. So that's a problem. Okay. The other things is very important is that in normal aging, you are completely independent mentally. I'm talking. Okay. Obviously, if you have a surgery of the right knee and you cannot walk, so that affect your function. That's different. Okay. I'm talking about activities that require the cognition. Okay. I'm talking about that. So patients with normal aging deterioration in terms of cognition, they are completely functional, mentally functional. They don't depend on anybody, different from people with dementia that they have functional impairment. They depend on other people to do the regular daily activities. If you like this video, don't forget to subscribe to my channel, like, and I see you soon.